Hello, my name is Nazar Today I'm going to perform the skill for administering medication, piggyback intermittent intravenous infusion. Yeah, I have my patient's name is Mr. Shepherd, a 72 years old male, and admitted to the exacerbation of COPD to the med-surg unit. He has a primary IV running, D5.5 normal saline at 50 ml per hour by gravity. Now I'm going to check my the doctor order. Doctor order said that Rosifin 1 gram in 100 ml IV daily to be administered over 30 minutes. The drop factors for the tubing is 10 drop per ml. So I'm going to calculate how much the rate. So in my calculation is the 100 ml times the drops rate is 10 divided by 30 minutes. So it will be equal 33 drops per minute. Okay. First, I'm going to gather my supply. Gather my supply, what I need, and I look in the MAR order again. I check the order that the patient have a order for the Rosifin, and I'll go to the dispenser and I check in the dispenser and I look in the dispenser that Mr. Shepherd has the order for Rosifin for today. And after that I take the medication, it's over here, and I check the medication and compare with the name. Oh, okay, that's correct, the name is correct, and the expiration date still valid, and patient do not have any allergy to this medication, the Rosifin. And also I check the compatibility with the IV that is running right now, the primary IV. Okay. Now I'm going to my patient room. I introduce myself. I wash my hands, or I close the curtain and for the privacy. I introduce myself. Hello, Mr. Shepherd. And you have an order for the IV medication. And patient say, okay. And I explain to the patient what is the purpose of this one. And you have the Rosifin is for the to help you with the inflammation, bacteria in the body that you're gonna remove and help you with the bacterial infection. So now I'm going to ask my patient, can you, I check the ID band, and can you state your name and date of birth? And that's correct. And see that he doesn't wearing any allergy band, allergen to anything. So now I'm going to scan her names and connect to the EMR. And I scan the medication too to make sure that's the correct order. Yes, Rosifin 1 gram, 100 ml to given in 30 minutes. Okay. After I explain everything, and I'm going to assess my patient IV site, make sure there is no infiltration or inflammation or phlebitis. So I check the site, and it's clear, intact. Okay. Okay. Now I've washed my hands and put my gloves on. And I'm going to take my normal saline and I'll take the alcohol pads and clean the site. And after that, I open the clamps and I'm going to flush your IV site. Make sure there is no bubble, no air in there, and after that I aspirate. Make sure the blood come out. Yep, I can see the blood coming up, and I push that back in. Okay, and I close it back and I clean with the alcohol pad. Okay, I discharge this in the Sharpie container. Now I'm going to prime my the piggy bag, the IV piggy bag. Okay. Okay. First, make sure I close it. Close this. And before I spike them, okay. Make sure I'm not touching so that not contaminating. Now I'm going to push and twist it until I reach the medication and make sure it's flowed, and I hang them up higher than the primary. Make sure I fill the chamber, at least a half of it. And I open this tube here and I will prime it until reach the end of the tube. All right, and I close it. Make sure there's no bubble. Okay, make sure I secure this one with touching the end of it. Now this is the primary bag, and also earlier make sure I check the compatibility. Maybe I already say that, but I just want to make sure I didn't forget the compatibility with the primary IV that he has. Now I'm going to connect with the primary IV. Make sure I clean it with the alcohol and I touch it. And after I touch them, and okay, now I'm going to connect them with my patient IV site. Carefully remove the cap and I attach it. Make sure before I open it, make sure I calculate 33 drop per minute. So because this is by gravity, make sure in 15 seconds at least the drop is make sure the drop is 8 drop per 15 seconds. All right. is 8 drop. 15 seconds will be equal 33 drop per minute. Okay. Open, make sure it's flowed, run smoothly, and okay. My patient is stable, reaction to it. Now, after I did that and everything is flown, and I already opened the clamp, I'm going to remove my gloves and perform hand hygiene, and I documenting it. But before I document it, I make sure I put the label on the tube. Put the label, put the date and the time, my initial that I give this IV. And I'm going to document it, how my patient react to the medication and the time, and documenting I give administer the medication. I think that's it. Thank you.